It's a time of incredible hope. There are wonderful initiatives underway that will really benefit our patients and families. The biggest areas of concern and priorities should be improved access and equity for care, finding new treatments so that we can deliver high quality care, focus on children and youth and early intervention for our patients.
Everybody that's dealing with these issues has to be involved in a team approach to really give the best service. So that would be number one. Number two is I think we need better diagnostics, a modern alignment of diagnostics with the delivery of the best drugs would be priority number two. And priority number three would be to recognize that mental health issues are complex in nature and that we need to be providing skills or maybe a retraining of individuals who are dealing with the challenge of mental ill health to allow them to be more self-sufficient and to be reintegrated back into society once they have their symptoms stabilized.
Number one is that we have to have the capacity to deal effectively with people who need mental health care in primary care. We know that about 80% of all mental disorders can be effectively treated in a primary care setting. We know how to do it, we just have to do it. The second area is we have to link schools and healthcare together. We know that most mental disorders begin, that is, they can be diagnosed before the age of 25. And our young people are in one of two institutions. They're either in schools or they're in jails. Linking the school to the healthcare system, we can early identify young people who are at high risk for mental disorder. We can triage them, we can intervene both on-site and off-site, and we can support them so that they can become successful in school and then successful in the rest of society.
I think for me, the important thing is access to care. I know that we have a long way to go in finding the right treatments for people and in having better outcomes, but I find it very frustrating to know that the good outcomes that are possible and the treatments that are available are not available to everyone. To disseminate knowledge effectively, I think right now there are pockets of excellence, there are great research being done, great ideas being generated, but sometimes they sort of get stuck in one place or they're not shared in a way that is to the benefit of all the people who suffer from the illness. The third one would be to perhaps stop talking about mental illnesses as if they were one thing. I think we talk about mental illness, the stigma, how prevalent it is, how terrible it is, but that includes people who have mild, temporary problems that can be resolved quickly, people who have very severe illnesses that will accompany them throughout their lives. So in that way, I think education and getting the right messages out, making a distinction between prevention and caring for those who are already ill.
Well, I think if we're going to really make a paradigm shift in the quality of care that is delivered to patients and their families, we need to continue to experiment, by which I mean we have to look for new ideas, innovate and do things differently. We have to evaluate, we've got to learn what works, we've got to understand what works and why it works and in what setting. And then when we know what works, we need to evangelize, we need to get out there and advocate to people that this is what they should be doing and this is how they should be doing it.
There's a lot that we don't know about how to treat mental illness, but there's also a lot that we do know that we don't do with regard to treating people with mental illness and assisting their families. So I think that we need to work on both levels. One is we need to do more to try to understand what's the nature and causes of mental illness, but also to figure out what kind of treatments work most effectively. But finally, there's a third piece, which is how to better implement those treatments that we do know are effective, those kinds of interventions that can make a difference in the lives of patients and their families.
I think there are a couple of areas. First of all, we need to reduce in Canada the level of stigma and discrimination that exists toward people with mental illness and their families, because that not only compounds their suffering, it also discourages them from seeking help even when it's available. However, the second thing is that when help is sought, all too often it is not available, whether it's at the primary care level or at the specialty level. And then the third thing would be that when people are actually successful in getting help, whether it's at the primary care level or the specialty level, are they getting the best possible help in terms of what the evidence is informing us works best for people with mental illness? And unfortunately, the answer is no.
Well, I think there are ways that healthcare systems can organize so they can be much more user-friendly. People can get the care they need when they need it. The idea that services are organized so that they are patient-centered, that is, they're organized to really meet the needs of patients and address their concerns, that's a pretty new idea. Healthcare services, for the most part, have been organized to meet everybody else's needs but patients. So meet the needs of doctors, meet the needs of nurses, meet the needs of hospital administrators. Organizing services so that they actually address the major patient priorities is a new priority, and I think a very, very important one. We also can't pretend to know what those patient priorities are, so I think the idea that if we want to understand what's important to patients, we actually have to start finding ways to ask patients rather than tell them. We have to move away from the separation of psychiatric or mental health care from medical care. We're now aware that for a long time, patients with serious mental illnesses have huge medical problems that end up shortening their lives by 20, sometimes 25 years, so that many people with mental illness, men with mental illness, are dying in their 50s as opposed to their 80s, where otherwise healthy people would be having a life expectancy of that range. And we do need to find a way to make sure that we can educate our other doctors, nurses, and health professionals so that our patients have the same access to excellent care that other Canadians have.
I think we're looking at stigma certainly being the first one. The second one is going to be access to services, whether they are medical, social, whatever services clients need. And the third one is housing.
The biggest barrier is a lack of integration and alignment across the system. There are many pockets of excellence, but they're not lined up the way they need to be, and we haven't had the necessary leadership to put them together.
I don't think that the health professionals receive the full spectrum of training that they really need in order to understand the complexity of mental illness and how it's best treated. Another barrier is the integration of research with the delivery of best care. There simply isn't enough money being made available in the system to provide the adequate care. You know, at a conservative estimate, mental health illnesses account probably for, conservatively, 20% of the health budget. And yet they receive, again conservatively, maybe 5% of the monies available. So there's a huge shortfall here.
I think one of the big problems that we have is that we have not yet had the political will to make the difficult decisions to reallocate the resources that are necessary within our healthcare system. And also we need actually more money in the healthcare system. We have to think about how we deliver healthcare differently.
Well, I think lack of coordination and lack of centralized mechanisms that allow the good things to come together, people to share ideas, and then to transfer them into the appropriate settings where they can be used to benefit patients. The other thing is stigma, of course, which we say it, of course, we've talked about it, but really in the last few years we've seen the impact of government, industry, the Mental Health Commission taking that on, and already people are starting to speak more openly. But I still believe that when it comes to individual people seeking treatment, it remains very shameful. Probably the most prejudiced people against mental illness are those who treat them. and that is really unfortunate.
Mental health is a very challenging area of clinical practice. It's not like cardiovascular, it's not like oncology. There are no sort of magic pharmacological bullets that are going to radically improve the lives of patients and their families. But the challenge around mental health is that we're combining a very scientific driven model of medical care with society, with the social setting, with people going about their day-to-day lives.
A lot of it has to do with the fact that there's just a kind of stasis, that people continue to do what they've been taught, even though what they've been taught goes back quite a long time. I think that we need to teach people some of the newer models of how to treat people. We also need to, in some ways, hold people more accountable, develop ways to better measure the quality of care, and then to use those measures as a way of improving care and incentivizing the improvement of care, to hold people accountable for how to improve care.
I think the stigma issue is one that's a systemic barrier in terms of prevailing social attitudes and behaviors, so that we have a great deal of work to do in that area. The second is leveraging technology. Canada is a very wired country, one of the more wired countries on earth. And so that there are opportunities that are still untapped to make information very accessible to people, and even to make help accessible to people. I speak as a psychiatrist who does a number of televideo consultations every week to Northern Ontario, so that there is psychiatric service in those communities that otherwise would never see a psychiatrist. So I think there's work to be done there. Similarly, having a knowledge exchange that's meaningful to ensure that practitioners of all stripes are armed with the best available evidence in an accessible format to deliver the highest standard of care for Canadians.
There's still a great deal of stigma, ignorance that goes on in our society, and a great deal that actually continues within the health professions as well, amongst doctors, nurses, and other health professionals, that do impede the ability of patients to get the care they need, and also make it very difficult sometimes for people to come forward and to acknowledge that they have a problem.
I think it's probably commonly understood and seen that stigma plays the largest role. And when I talk about stigma, it's not just stigma in terms of society and the individual, but it's his self-stigma also, which clients very often have towards themselves and their illness. And certainly for this latter one, the self-stigma, we are social beings. And as social beings, we need to talk, we need to communicate to others about our daily life, our daily activities. That's what social beings do. And when a large part of your time and thoughts are taken up by this illness, and you do not have the opportunity for one reason or other, either being of societal stigma or your self-stigma, to be able to talk about it and express it, you're denying yourself a huge amount of what makes you human.
The networks that we'll discuss today are absolutely the way to go. Collaboration, integration, partnerships, patients, families, professionals, government, all working together with a boost from the private sector, and their leadership will definitely make huge changes to our field.
Absolutely. I think that this is what is called for. We have examples in other countries. The United Kingdom has very successfully created a mental health research network which is very closely aligned to care delivery, and they've made tremendous strides in linking all elements of the country together to do better trials and find new solutions to these problems. We need to mimic those successes in Canada, and so the network that you describe would be a fantastic step forward if we could all agree to work together.
I think that is necessary but not sufficient. But if we don't start with that coming together, with that convergence we're not going to get to the goal. So this is a first step. It's a fundamental step. It's an important step. And I applaud the foundation for moving in that direction. Convergence is where we need to be, because if we don't have convergence, we will never have change.
Absolutely. I think no one has the means to do it by themselves. And I think each of the organizations that you mentioned has something to bring. I think we need to build a business case for treating mental illness. We need to help the government believe that there's an economic impact to treating mental illness properly.
So if a network has clear focus and it's going to bring together a range of practitioners and it's going to integrate from bench to bedside, from bench to bedside to community, then yes, it can make a fundamental difference going forward.
It all depends upon how you construct a network. Who are the parties involved? What the goals are, what the products are of the network, what's the processes by which you achieve those goals and products, to what extent does it really represent an amalgam of researchers, policymakers, patients, families, and healthcare providers. We've often used what I've termed the 6P model: patients and their families, providers, practices, that is, people working at the team level or in clinics, health plans or insurance companies. In your case, it might be those organizations that are at the provincial level, and policymakers. And once one gets to the policymaker, and then ultimately to apply it at a population-based level.
I think that the reality is that this matter is too important to be left to any one group of individuals, be they universities or governments or health professionals or the public at large. And so the reality is networks do need to exist, and the advantage of networks is pooling talent, sharing knowledge, and leveraging strength through numbers.
I think the idea that we need a network in mental health care is long overdue. We are aware that in other key areas of health care, very, very effective networks between providers, consumers, researchers, government, hospitals have been developed. Best example would be in areas like HIV as well as in breast cancer. We have had an excellent example in the last few years in the field of autism, where there's been an outstanding international network that's been developed that's brought networks of researchers together with family members, patients, benefactors, to make really remarkable progress in a field that was thought to be extraordinarily complex and difficult before. And I think that if we're able to do that for disorders like HIV or autism, it's time that we did that for other major mental disorders.
Absolutely. This is a very large problem in that it is not only complex, it is complicated, and it has many, many, many partners. Clients are involved, universities are involved, research centers are involved, care centers are involved, government is involved. Yes, they're all involved, and there has to be a place and a forum where they can meet and move forward.
The Boeckh Foundation has shown enormous leadership over the last decade supporting mental health research through partnerships, donations, and through symposiums such as today. The connections that the Boeckh Foundation has at all levels, the vision, the leadership, and the stimulus is really what we need to get things going. I'm incredibly hopeful for the role that the Boeckh Foundation and Tony can play in particular, and we're delighted to partner with them here at University of Toronto.
We absolutely need groups like the Boeckh Foundation that have shown so much leadership, from the perspective of the volunteer health sector and concerned community, working in partnership with CIHR, whom I represent, and then getting the provincial health and research communities together. Collectively, we can do this, and it's even more powerful when the call comes from the community, as it would if it came from the Boeckh Foundation.
One of the great things about the foundation is that it's not beholden to stakeholders that are beyond its control. And that's one of the difficulties. Political decision-making is messy. University politics are fractious. And competition amongst different groups of people is frankly giving us a problem, because we should be working collaboratively instead of competitively in the same area. So I think that, interestingly enough, it's probably through leadership which was outside of those traditional domains, which will allow those domains to come together effectively, because they'll spend more time thinking about how we can work on this together instead of how can I be the leader in this.
Absolutely. I think that we're talking about independent entities that have that don't have the time or the motivation to get together. And I see the Boeckh Foundation as an agent of change and, giving something, an incentive perhaps, for people to make the difference by bringing either knowledge together or coming up with ways that would be convincing to make changes.
I think an organisation like the Graham Boeckh Foundation is absolutely essential. This is the third year that I've participated in this conference, which is organised by the Graham Boeckh Foundation, and it's not an understatement to say this would not be occurring, these discussions would not be occurring without the leadership of the Graham Boeckh Foundation.
I think that's exactly the kind of role that a private sector group like the Boeckh Foundation can play. All of the other groups I've mentioned have limitations. They have certain types of stakeholders that they're in some ways tied to that limit their ability to be flexible, that limit their ability to take risks. Whereas the Boeckh Foundation can in some ways provide a kind of safety net for those risks and provide a kind of infrastructure to support the engagement of all the parties.
I think there's no question that a group of dedicated people like the Boeckh Foundation can make a difference. We already have a wonderful example of the private sector involvement with regard to Bell Canada and the Anti-Stigma Initiative, and the fact that they've championed this cause as a major Canadian and international organization. So I think that has blazed a trail for other players in the private sector to get on board with this cause.
I think that there's a newfound realization that our old models for achieving scientific progress probably aren't ideal. In the past, we would have relied very heavily on scientists, on clinicians, and I guess their hospital and university channels through government funding to bring about progress in the field. Progress has been very slow as a result of that, in part because the funding hasn't been very great. But also I think other sectors of the economy, other sectors of society probably have other skills and experience that can be very effective at making sure that goals are set and goals are achieved. That's not necessarily something that the hospital sector or the university sector is really outstanding at, but certainly business, private business, as well as the biotech and the pharmaceutical industry. These are industries with tremendous experience at being able to set goals and achieve goals. And I think it is possible, by having everybody work together and bringing in the type of organizational and managerial experience that both the private sector and industry itself have, could help us set reasonable goals and set timelines so that we can be sure we achieve them.
Totally. In fact, I think that it's only a private group like the Boeckh Group who can put this together. Once government runs groups like this, they are under pressure for so many regulatory aspects. They are under pressure to answer to so many pressure groups that it is difficult for them to move forward. A private group like this, it is just much easier. They facilitate it, and they are really the way in which we will get out of this and actually go somewhere, go forward.